For women who are diagnosed at an earlier stage of ovarian cancer, and it would be wonderful if this were to be more common, and certainly, I think that the ability to prevent ovarian cancer really is where we should be aiming. But so women who are diagnosed early may allow for the sparing of the other ovary or the unaffected ovary. And this can be really helpful because that remaining ovary will produce enough hormones to not put the woman into this immediate and state of menopause. Remember, too, that the ovaries not only produce estrogen, but the ovaries also produce androgens, specifically testosterone, which we have in a much lower levels than our male counterparts. But we do have testosterone, and testosterone or lack thereof has been linked to fatigue, and it is often commonly spoken of as being linked to desire or libido. There's a lot of conflicting evidence out there about this topic, but women will tell me frequently that once their ovaries removed, they absolutely lost all sexual desire, which has caused them problems. So surgery for ovarian cancer usually involves not only removal of the ovaries, uterus, and uterine tubes, or what we used to call fallopian tubes. After Mr. Fallope, we've now moved towards calling things by their anatomical names and not by men. So really most of the internal organs of the woman are removed. There might be as well surgical debulking of any visible tumor in the pelvis, and sampling of pelvic lymph nodes and the omentum, which is this fibrous and sometimes fatty layer that overlies everything in the abdomen. So sampling will take place. So as many of you know, this is really extensive surgery. This really plays a huge role on energy levels, and certainly body image can be altered as well, and I'm going to talk more about that in a little while. Obviously, psychological well-being is affected by the very real threat that this cancer has for women, and that really can alter the way a woman sees herself and really shake her world up significantly. We know from research that younger women are more concerned about sexual issues after diagnosis, and are also fearful that they will be sexually unattractive after treatment. Body image is huge for women. I just heard something on the radio the other day. I think it was a survey done by Chatelaine, and one of the authors or the researchers was interviewed on the radio, and she spent a lot of time talking about the role of body image in women's sexuality and how important it is that, we see ourselves in a certain way. And so something like an extensive scar running down the middle of your abdomen not only serves as a visible reminder of having the cancer, but for many women, they then see themselves as being unattractive to their mate. Weight loss, which may accompany cancer, and often happens after surgery, or almost the opposite of weight loss, the weight gain that some women experienced during the menopause, or swelling from edema, so changes in body shape following surgery really do affect how women see themselves as sexual beings. Women will commonly avoid being naked in front of their partner, because they are ashamed, embarrassed. Some women stop sleeping in the same bedroom as their partner. And, I think that while not appearing naked before your partner may appear to be protective and a coping mechanism, your partner gets pleasure from seeing you naked. So what tends to happen when you are dressing and undressing in the washroom or in the closet is that distance starts to happen, and the partner can feel very, very lonely. I am often confronted with couples who come to see me because they're experiencing sexual difficulties as a result of any number or any kind of many different cancers, and I am always constantly reminded that when distancing does occur between couples, it's often very difficult to find your way back to each other, that there are silences, there are things left unsaid. So one of the things that I'm going to talk about in a little while is some strategies around how to talk to your partner about sex, about body image changes during, after surgery and treatment. Most women with ovarian cancer begin chemotherapy shortly after the surgery, and the addition of these stresses, the mood changes, fatigue, nausea, obviously affects general well-being and sexual functioning, particularly sexual desire. Fatigue is very well described in women with ovarian cancer, and it can persist for months after the treatment. And I think for many women, there is this assumption that once treatment is over, they will go back to feeling like their usual self, and this doesn't happen and can be very concerning and depressing. Fatigue is associated with decreased quality of life. It's associated with increased anxiety and depression. And of course, all of these impact how we see ourselves and act as sexual beings. One of the things that women are most concerned about with chemotherapy is hair loss. And one of the things that healthcare professionals don't talk about often enough is the fact that when you do lose your hair because of chemotherapy, you're going to lose your pubic hair too, not just the hair on your head. And I've had many women who say to me that this was a complete surprise. No one had warned them. They're absolutely devastated by this. And that when they don't have pubic hair, they feel like little girls. So any attempt at any kind of sexual contact just feels wrong for them. I think this is particularly interesting given the propensity that we see in society today, where women tend to remove, or younger women I think are having Brazilian waxes and getting rid of all, most, if not all of their pubic hair. Those of us who are a little bit older often will have a different attitude to this. So the loss of pubic hair can be quite devastating and have, quite a global effect on self-image. Ovarian cancer can also leave a woman feeling inadequate in her role as partner, wife, mother, sexual partner, or even as a whole woman. And, even though I think healthcare providers and support providers will say you're still a woman, it really doesn't matter what the rest of us say. What really matters is what that woman is feeling like. And there is often a lot of pressure, sometimes placed by women on themselves, that they have to be a certain way, and that a reluctance or refusal or inability or unwillingness to be sexual with their partner is necessarily going to lead to relationship breakdown. This does not always happen. It often does not happen at all. But I think that there are many women who perhaps are being sexual when they really don't want to, maybe experiencing pain associated with sexual touch, and very often the partner may also be very fearful because they don't want to hurt their loved one. They don't want to demand sex, but it's complicated. So if couples are not talking about this, there can be assumptions, there can be a whole lot left unsaid, and there can be great misunderstandings.